Why does pregnancy improve multiple sclerosis but worsen lupus, despite both of them being autoimmune disorders? Now, this is one of the most important concepts that will be tested on the USMLE, so let me break it down. I'll ask you first, watching this, what type of autoimmune response drives multiple sclerosis and what drives lupus? Because if you understand that distinction, this whole paradox will make sense. All right, so multiple sclerosis is primarily driven by Th1 and Th17 cells. These are T helper cells that promote cell-mediated immunity and inflammation. In multiple sclerosis, these cells are attacking myelin in the central nervous system, while lupus, on the other hand, is primarily driven by Th2 cells and B cells producing autoantibodies. So lupus is an antibody-mediated disease with immune complex deposition. Now, what happens during pregnancy? The mother's immune system has a problem. The fetus is essentially a foreign draft because it carries paternal antigens. So to prevent rejecting the baby, the maternal immune system shifts from Th1 towards Th2. That is going from cell-mediated immunity to humoral immunity. This Th2 shift is critical for maintaining the pregnancy. Well, think about what this means for autoimmune diseases. If you have multiple sclerosis, which is Th1 driven, cell-mediated immunity driven, and pregnancy shifts you towards Th2, humoral immunity, you've just suppressed the very cells that were attacking your myelin. That's why multiple sclerosis relapse rates drop dramatically during pregnancy. Patients often feel the best they have ever felt in years. But if you have lupus, which is already a Th2 and anti-driven body response, that same shift is powering gasoline on the fire. You are enacting the exact same immune pathology that's causing your disease. That's why lupus flares are common during pregnancy. Lupus nephritis can worsen, and the combination of pregnancy hypercoagulable state plus anti-phospholipid antibodies makes thrombosis risk skyrocket.